But if I talk to them about suicide, won't that put the idea in their heads? Hey guys, today I'm going to talk about some of the causes of suicide and some tips on how you could talk to someone about it that you might be a little bit concerned about. Before I get into that, if you like videos on mental health and psychology, just click the subscribe and notification button so you guys can follow along and you won't miss out on any new videos. So the saddest thing about suicide is how it affects us all and some of the staggering statistics around it, especially for young people. One of the statistics is that for ages 10 through 14, suicide is the second leading cause of death. That means for basically middle schoolers, more middle schoolers are dying by suicide than cancer or any other disease, and I just think that's really tragic. If you go up the age groups a little bit more, for ages 25 to 34, suicide is also the second leading cause of death. First, I'm going to talk a little bit about the causes of suicide, but if you want to skip ahead to how you can talk to someone about it, go ahead and do that. When we talk about causes of suicide, really we're talking about risk factors, because there's not one thing that we can say definitely causes suicide, but there's a couple different things that will increase the chance. One of the best theories to explain suicide is a researcher named Orden who came out with this theory in this diagram I'm going to walk through with you guys. In this diagram, we're starting on the left with some risk factors and we're moving left to right. And as we move to the right along the diagram, more risk factors will lead to a higher chance of this person committing suicide. So at the top left of the diagram, we see a circle with the word loneliness in it. So loneliness is one of the biggest risk factors for suicide. And we know this because during COVID, when people were isolated in their homes, away from family, friends, and coworkers, we actually heard that the suicide rate increased during those lockdowns. Below loneliness is another circle that says reciprocal care. So normally we have caring relationships with friends and family where we're checking in on them and they're checking in on us, and that's called reciprocal care. But when a person doesn't have any family or friends to check in with or to have care for them, we wouldn't have reciprocal care, and loneliness and no reciprocal care would lead to the other circle to the right called thwarted belongingness. And this person would have thoughts that they are alone. So if a person has the thought that they are alone, then this could lead to passive suicide ideation. Passive suicidal ideation is when they're thinking about suicide, but they're not really intent on actually going through with the plan or actually killing themselves. On the bottom left of this diagram, we have another risk factor in a circle called self-hate. So if a person hates themselves for whatever reason, they feel like they've failed financially or they let someone down, they may have self-hate. And there's a circle there called liability. They may feel like a liability or a burden to friends and family. If they have this feeling that they're a burden, that is going to also lead to passive suicidal ideation, where they'll have thoughts, but they're not intent on carrying out the plan yet. Now, this diagram shows increased risks if the person both has thoughts that they feel alone and that they're a burden. Those two arrows converge on the circle that says H2, which stands for hopelessness. So if a person has hopelessness, they feel like this feeling is never going to get better. And when someone feels hopeless, they may start actually having the desire to kill themselves. Looking to the right, we have another circle that says lowered fear of death. So a good example of this is in veterans that have seen combat. They've already faced death in war and put their lives on the line. So when they're thinking about killing themselves, they don't really have as much fear. There's another circle that also says acquired capability. So veterans have access to firearms usually, or acquired capability could also mean access to drugs you could overdose on or any other way to kill yourself. The next circle says increased pain tolerance, which would also apply to veterans. They've been through intense training or they've been in combat where they've already experienced a lot of pain, so they're not afraid of the pain of killing themselves. This could also apply to maybe intense athletes or people who do dangerous work or dangerous hobbies. So if we have all the elements that I've talked into this diagram up to this point, this person would be at a really high risk for suicide, and it could lead to the last box, which says a lethal or near lethal suicide attempt. So now that you guys know some of the causes and risk factors of suicide, we can use this in how you're going to talk to the person about it. Most important thing to remember in talking to someone about suicide is to get out of your head a misconception that if you talk to them about it, it's going to cause them to do it. This has been disproven by research, and that talking to someone about it actually helps them get through these feelings. The best way to talk to someone about suicide is just to be direct and say, hey, I've noticed that you seem sad, or I've noticed that you seem withdrawn. So that first statement shows that you care about them and you're reaching out. And then you want to follow that up with the direct question of, I'm wondering if you've had any thoughts about killing or hurting yourself. Because you're asking them this question, it actually gives them the chance to open up and tell you. Because someone who's been thinking about suicide isn't going to tell you a lot of times because they feel guilty or ashamed. But when you ask them directly, they will actually open up to you. If the person says no, they haven't at first, that's okay. You probably still want to follow up with them on a different day or a couple other times and just asking them to give them a couple more chances to open up to you. If they do start opening up to you and telling you that they have had thoughts of suicide, the next thing you want to do is kind of assess their risk level. Ask questions to see how much they've really thought about it, how intense their thoughts are, and if they actually have a plan that they've thought about on how they would carry it out. You could ask them a question like, if you were to kill yourself, how would you do it? Or have you thought of a plan of how you would do it? Then your response is going to range from something like, it's really an emergency because the threat to themselves is immediate and you would want to call 911 in that situation. Or you may have a more laid back approach where you know that it'll be okay to just check in with them in the coming days. If this is your child, I would try to set up a doctor's appointment or a counseling appointment so that they can start getting the mental health help they need. And you could ask a doctor about setting up medication or therapy. What a therapist or a counselor would do then is set up a safety plan with them. So when they're feeling the thoughts of suicide, who on their plan are they going to talk to, and what are the coping strategies they can use to get their thoughts away from suicide? The next thing you want to do is take away their access to firearms, drugs, or anything they could use to actually carry out the suicide. You also want to make sure someone's monitoring them or they're not left unsupervised, because anytime they're alone could be a time that they decide to go through with the suicide. So if you're a friend, just call them at least once a day to check in on them, or maybe take some turns with other friends and family of calling them just to check in, and this is going to make them feel cared for and less lonely. So those are some of the first steps and ideas, guys. Obviously, you want to seek professional mental health treatment, but my biggest message is that you want to ask them directly if they've thought about suicide and just get the conversation started. Definitely comment below anything more you're curious or want to know about it. And thanks for watching. I look forward in seeing you guys in the next video.